Hello and welcome back to the Health Check by iSpy Optics. This is the podcast that brings you everything related to health. And today we are very honored to have a guest who is bringing us a topic that most people tackle in life, and that is the esophagus cancer. We'll explore the risk. We'll start from what the cancer is really about, the risk, symptoms, causes, and what we can do as individuals to avoid it. Thank you so much, Florence. Karibu.
Asante.
So tell us, you're an oncologist.
Yeah, my name's FLORENCE KANDIE. I'm a nurse. I'm an oncology nurse. I've worked for over 20 years and I've specialized now. I've worked for 6 years since my specialization. Yeah, and I work in MTRH. I'm also the Vice President of Oncology Nurses Society of Kenya, which is a vibrant chapter, and it's really doing very well. We have several nurses, over 500, and it's a vibrant chapter currently.
In a layman's language, what does an oncologist do?
Oncology is a clinician or someone who deals with cancer patients. Cancer patients, there are those who are on treatment and there are those who are palliative. So it's cancer or those who are working at cancer space. Yeah.
Okay. So guys, for the first 2 episodes, we've been talking about vision correction, and today we are talking about something that affects a lot of people. That is the esophagus cancer. Now we can dive into it. So tell us, what is esophagus cancer?
Maybe before I say what is esophagus cancer, esophagus is one of the pipe which takes food. When we swallow food, it goes through the esophagus to the stomach. So it plays a very, very important role in a human being. So that is esophagus. Without the esophagus, we can't take food. It will be challenging. So now let me come back to what is esophagus cancer. Esophagus cancer is the cancer of the esophagus. And it's particularly that esophagus where it is. And this cancer is very common. It is very common in our country. And majorly, it gender. Most men suffer esophagus cancer than ladies because of the risk factors.
Okay. So esophagus cancer, do we have different types of esophagus cancer?
Yeah, we have 2 types of esophagus cancer. We have adenocarcinoma cancer, and we have a squamous cell carcinoma. So squamous cell carcinoma is just be above the when the esophagus cancer is like 15 to 20 centimeters. If you divide into 2, the top layer it's affected by squamous cell carcinoma, which is very common and which is brought by lifestyle. And then now the adenocarcinoma is below. This is mostly genetic and other factors, risk factors. So we have 2 types of esophageal cancer.
Okay, and what really causes the esophagus cancer?
Yeah, thank you. That's a very good question. We have several causes of esophagus cancer. Number 1, that is alcohol, and those people who really take a lot of alcohol. Number 2 is smoking. Those are number 3. We also have people who take. Number 1, it's caused by alcohol smoking. Alcohol smoking. This one, the 2 of them makes the carcinogen, that makes the wall of the esophagus to erode. So the more you take the alcohol, the more you take the tobacco, it erodes the esophagus. So when it erodes, it will make the cells to multiply in an abnormal manner, and that is now it will bring cancer. And the definition of cancer is it's abnormal multiplication of the abnormal cells. So when it multiplies, it will bring the tumor in that throat. Yeah. So other causes can be lifestyle, maybe obesity, and also diet. Diet can also cause. You find most people don't take balanced diet. You also find those people who are obese. If you are obesity, you are also at risk. Also, it can also run in families, but it's not 100%. It can run, but it's not 100%. It's not that if my brother had cancer for esophagus, I must have it. Yeah, so it's 50-50. But nowadays, it's just rampant. Yeah.
So about alcohol, speaking of I said today's generation, most youths do take alcohol on a daily basis. Can you tell me more about alcohol and esophagus cancer and what and what not to? Because there's cheap alcohol, there's zile zinakwanga kali kabisa, kuna wine, and then these are
we say alcohol is alcohol, but nowadays there are also those cheap alcohol, and cheap is also expensive. I know everyone knows that. This cheap alcohol, they are not made properly, or maybe they're just made with local things which are not really tested. Yeah, and it's not certified by KEBS. So mostly we find those alcohol are they are very corrosive in the esophagus, which will suddenly lead to cancer of the esophagus. So if you must take alcohol, take good alcohol and just take small or little alcohol. Yeah, but for this cheap alcohol, people just take, you find the bottles are thrown everywhere. Those are just risks in life.
That is so hard for the youths to take in, because recently I heard that there are some these brand of alcohol that are being packaged outside the normal brand.
Yeah.
For instance, I'll give an example of Kenya Ken.
Yeah.
Kenya Ken, there is a Kenya Ken company. Alafu there is the second hand Kenya Ken where they package I'll say the cheap cheaper, and let's say with a lot of acids and all that. Now that really affects a lot of people.
So I think also the government should work on it, so that the government, the Bureau of Standards should make sure the right things are in their counters. Yeah, it would really of much help to the nation and even the young gences of this country. Yeah.
So what are some early signs that people should know about esophagus cancer?
So esophagus cancer, it's really rare. For you to know, you need to critical think. I'll also tell the public that any abnormal sign in your esophagus, you need to treat it urgently and just see the doctor. Number one, there is dysphagia. Dysphagia is difficult in swallowing. You are trying to swallow something, but it's like you are really struggling to swallow it. So that is a major sign, and it's very very common. And this can happen due to mechanical and functional disorders. We also have heartburn. Heartburn, yeah, just normal heartburn.
Okay.
So heartburn, people will say, I always have heartburn, acidity. You find people rushing to the chemist buying antacids. Also, others will just go for milk. And heartburn is not a joke.
And personally, I think I have normalized heartburn in that when a heartburn, you just take some
No,
both
we
pills.
demystify, and from today, if you have any heartburn, just go for medical checkup. That is a big sign of that there's something abnormal in your body. Yeah. So sometimes the heartburn will continue until maybe at midnight you feel like what you took for supper it's coming back. It's like regurgitating. So people will think it's just normal heartburn. So that's a very dangerous sign of cancer of the esophagus. Yeah. Well, we also have hematemesis. Hematemesis, like when you can cough blood or when you can vomit blood. That's also a bad risk of cancer of the esophagus. Yeah.
Are there some common, I'll say, mistakes that are commonly mistaken to the esophagus cancer? Because if you say, let's say, sore throat, that could be something else. So I want to know something that is similar to esophagus cancer, but it is not.
Yeah, some people may be having hyperacidity. You can have hyperacidity, but it may not be esophagus cancer. No, so it depends on also what you eat. Maybe your lifestyle, you eat a lot of food which has high spices. So like for men, they take alcohol, they also take a lot of meat, and it has a lot of spices. So sometimes it can give you that hyperacidity. Yeah.
Okay. Uh, I know, let's say, if we talk about the early signs, do we really have the early signs that someone should watch out? Or they just come?
Yeah, we have early signs in every disease. Mostly, you'll have that sore throat. You'll have like you feel like there is something in the pipe of that food, that is the esophagus. You like try to take something heavy, you can't take it. Like maybe potatoes, or even sweet banana. You feel like there is something, so people ignore it and they think maybe my esophagus is thin. So those are just some things people should really check on it and really know what about it. They should really check it.
So basically, people should not ignore anything happening to
Anything on
them.
the sore, people should not ignore it. While swallowing, people should not ignore it. Sore throat and even discharge. Some can even have that discharge like more salivation, which is you are seeing salivation and it's heavy and it's increasing with time. So people should just check on it. It can also cause adenocarcinoma. That is another type of cancer of the esophagus. Yeah, you'll find you have a lot of you find a lot of saliva and it's thick.
Okay, okay.
Yeah.
Most people really ignore these small things. Because let's say you're working, let's say 12 hours a day, your work is demanding. Now you have a little heartburn or let's say sore throats. You just be like, after a job, I'm going to get some pills, I'll be fine. No.
So we also, this country nowadays, the economy is so tough on us. But let us
Yes.
try to eat balanced diet and also take water. This water will also, if it was a normal hyperacidity, when you take water, it will just go away.
Just one
Yeah,
minute.
let us also try to take a balanced diet and high protein, high vitamin to make sure our immunity is boosted because we work for long. Also, for those people who work in factories and maybe handle chemicals, it's also good for them to wear that mask. If you like work in a chemotherapy unit and maybe you also do, maybe you are spraying your animals using those deep and other
Yes.
chemicals, it's also good for you to take precautions, put on PPs.
Yes, and you know, people don't, personally, back home, when people are spraying plants, kettles, they don't put on mask or anything. They
So
just
they need to
mist.
know and they need to take precaution because those are also chemicals and you are just inhaling them.
Yes,
When you are
yes.
spraying maize, maybe like 5 acres, yeah, you should just put on those PPs, the gumboot, the goggles, the mask.
Just taking
And then
this.
when after doing the procedures, it's also good for you to just take a bath and change the clothes and make sure also those things are kept in a safe place, maybe far away from where you sleep.
And I see people drinking milk after spraying. Does it really help? It's like
No,
you're washing off the chemicals.
no, it's just good to take milk, but it does not have any relationship between cancer of the esophagus and that milk.
It's not going to help in
Just
any
put on the
way.
PPs.
Mhm.
Yeah,
Ah,
PPs, you will be 100% safe. And we'll also tell our public, just put on those PPs wherever you are, including medical personnel.
okay.
Yeah.
So, what are the factors that increase your chances of developing esophagus cancer?
The factors, I've said obesity.
Mm-hmm.
I know everyone understands what is obesity.
Yes,
I
yes,
don't
we
need to
do.
because everyone is on diet. Obesity, tobacco intake, alcohol intake, and also exposure.
Exposure.
Yeah,
Mm-hmm.
exposure to chemicals can also cause.
Okay. And how is the esophagus cancer diagnosed?
So, diagnosis of esophagus cancer, you have to go to the hospital. The doctor will see you. There are several ways we can diagnose you. Number one, we do a CT scan, of the throat. We also do a CT scan of the chest and the abdomen of the head to see if there was cancer and has it moved on. We can also do the blood test, CBC. We'll see if you have any anemia because sometimes people bleed, sometimes people don't eat. Of course, I forgot the history taking, which is very key. When you come to a doctor, they'll tell you how do you feel. You'll start complaining. I have difficulty in swallowing. I have difficulty in. I have a lot of heartburn. I don't sleep. I don't feel well. Yeah, you'll feel like there's something sticking on your esophagus. So those are just like physical exam. So the main thing apart from the CT scans, we have several CT scans. I've said the head, the chest, the abdomen, and we also have something called PET scan. PET scan is to see if you have any cancer in your body, and these are very expensive procedure, and I think it's not even in Eldoret. I mean, it's a very expensive one, but it's the best. And I know it's done in Nairobi somewhere. So PET scan will see if this cancer, if it was there, has it gone to the bones? Because esophagus cancer is a killer disease. It can also metastasize to the bones and other organs. Yeah,
I think you've said it's expensive.
it's expensive.
There's someone hustling and they want to know if they do have cancer. I don't. It would have been fair if the prices were a little bit lower. But when I was in school, we did have cancer people coming around. They used to take some tests, but it wasn't that thorough. But at least during that moment, you'd go in to take some few checkup. I think that one really helped the
We are also
people.
trying to do sensitization like today so that people will know and you tell a friend to tell a friend. We are also trying to go to the community to know esophagus cancer is a killer disease. So information is power and people should just take it seriously, starting from even those young children. Information is, I believe we start even from the primary school. When they grow up, they know what is cancer. Not only esophagus cancer, but they know also the lifestyle. Yeah.
So tell me about the staging of the esophagus cancer.
Staging, we have 4 stages, and if you stage 1, stage 2, stage 3, stage 3, 4, stage 4A, and stage 4B. So in stage 1, this is where the tumor is localized. It's just a small thing. And if it's known early, you can be taken to theater. They just remove that tumor, which is localized in the esophagus. Then thereafter, they can give you chemotherapy and they can give you radiotherapy, and you're just good to go. Yeah, so that is stage 1, and you
That's
can be
okay.
treated and you can be healed.
Yes.
Stage 2, moving forward now, it's somehow tricky, but
Mm-hmm.
we are still trying to assist you guys, those who are diagnosed.
Uh-huh.
So stage 2 is where it is in the esophagus, but it has moved kidogo. Yeah. Then stage 3 is almost, it has moved from past the halfway of the
Mm-hmm.
esophagus. And then now stage 4, it is now localized in the esophagus,
Mm-hmm.
from the outer layer to the inner layer.
Mm-hmm.
Now stage 4B is whereby this cancer has gone all over the body. That is now called as metastasis. It is in the brain, it is in the lungs, it's everywhere. So now treating that one is a bit tricky because it's now all over.
Mm-hmm.
So basically, in summary, it can be diagnosed early and you can be treated. All the same, if we are fine in any stage, we can still pick it from there and we support you fully. But with my experience, people don't die because of staging. People die because of ignorance. So if you ignore yourself and your people don't take care of you, and sometimes also you don't have that cover, SHA is really doing a good job. It covers most of this medical management. So if you don't have a cover, also it's a challenge because you can't pay cash.
So people should just apply for this
Each and
insurance.
every member of the public should have
Should
a
have
medical
insurance.
cover.
Uh-huh.
Yeah, starting from Jubilee and others, and but SHA is the government
Is
one.
the best one.
Yeah, it's a comprehensive one.
So basically, the earlier the stage, the
The earlier,
better.
the better, and the earlier, the better. Some are diagnosed at stage 1 and they disappear because of meals and other things, and because the relatives are also not for the medication. So they disappear thinking that the stage is still stage 1. Coming after 6 months or after 1 year, it has really gone to stage 3, 4.
And probably,
So the earlier, the better. And when you are diagnosed, I'll just pick it from there and you just move on with the medication
yes,
and
yes.
things will be good.
Probably they see that the signs are not that bad at stage 1.
No,
So,
some go to hubs, some go to do the villages. They are wasting time. But let me tell
oh,
you,
the traditional
the more you waste
medicine.
time, the more it will reach a point where you can't even swallow anything. We have to boot your tube.
Uh-huh.
Yeah.
Okay, okay. And at what stage do most patients get diagnosed?
Most patients come at stage 3 and stage 4 because they really think they are busy in the chemist buying the ESO kit and other things and taking milk.
Mm-hmm.
And for ladies, they think this is just something which will clear off.
Mm-hmm.
Yeah, so most of our patients come at stage 3 and stage 4, but we still do and manage them well.
Mm-hmm.
Yeah, we give them chemotherapy, we give them we manage them depending on the stage.
Okay.
Yeah.
About lifestyle, can lifestyle lower someone's risk of getting esophagus cancer?
Yes, it can.
Mm-hmm.
So lifestyle, you can't compare somebody who is taking alcohol and someone who is not taking alcohol.
Yes.
Years back, you find now maybe our fathers or our grandfathers could get cancer at later stages, maybe at 45 and above. But nowadays, everyone gets cancer. Everyone can access alcohol. Lifestyle is like majensi, watu wanajibamba kila siku pombe pombe. They are in those vehicles taking alcohol throughout. So lifestyle is really matters.
Mm-hmm.
So again, food. We are in an economy whereby we can't afford balanced diet, or where like we are very busy. We
Yes,
can have the
yes.
food, but we are very busy for ourselves.
Yeah.
You can find somebody in the house, they have all those balanced diet but they don't have the time to cook. And most of us are on transit. We just buy over the counter a junk food like the mala, those junk food, the wheat,
Sausages.
the wheat,
Yeah.
mandasi, chapati,
Keki,
keki,
cookies,
cookies, and milk, and as you
mandazi,
go.
all those.
So we are here today to say balanced diet is very, very, very key. And I always advise even my fellow women to be taking their lunch. Just carry your lunch, warm it, eat your small ugali and mboga and a balanced diet.
Yeah.
You can also boil eggs and you go with it. So your food from home is more safer than even what you buy, because again you don't know what type of oil was used.
Mm-hmm.
So going forward in this country, I think people should just know that balanced diet is key in life.
Okay.
Yeah.
You've spoken about Gen Zs and say our fathers. Is there anything about the age
Yeah,
and esophagus cancer? Are they related in any way?
Yeah, initially, age, most of our clients are above 45 years, and most of them, if you take history, most of them are those who took alcohol and cigarette smoking.
Yeah.
Uh, Majority are those who are heavy drinkers and heavy smokers, and also tobacco. But nowadays, our sons and daughters, they just get these things over counter. They are just all over. There are also these drugs, I don't know the names, Jukubera and the rest. They just buy at 20 shillings. Kitambo, you could not access these things, but nowadays they are just all over. So we are worried. The trend will be very bad. So it's good for these people to know, just keep off those drugs.
Okay.
Yeah, it's very good to just be yourself.
Okay. When should someone see a doctor?
When you see a doctor, you just go for medical checkup. Even if you are not sick, even you can see the doctor tomorrow.
If I'm just feeling okay, I can say,
Yeah,
let
just
me
go
go
for
and see the
checkup.
doctor
Just
today.
go for checkup. Just go and get that health education. A doctor will always advise you on many things. So let us not wait for the sickness to come, then we go.
Okay.
And also, again, maybe if you have a relative who had cancer, it's also good for you to see a doctor and also get a psychological counselor. Many people live in fear, thinking that my mother had cervical cancer, my father had esophageal cancer. Maybe, yeah, people should also just see the doctor when you are not sick. It's very advisable to just get that knowledge. If you are in a position to Google, you can also Google.
Google.
But it
It can
has its
mislead you.
challenges, but it's just good to see a doctor, and you can see a specialist like
Okay.
us. We are there for you.
Okay. Now about treatment and recovery. What are the main treatment option of the esophagus cancer?
Not only esophagus cancer, for all cancers,
For
we
all
have three
cancers?
main source of treatment. Number one is surgery. Surgery is whereby you are taken to theater, they do operation, they remove that part where the cancer is by a specialist, a surgeon. Number two, we give you chemotherapy. Chemotherapy are drugs which are given through the venous, IV, intravenous drug, and it can run for many hours. Some can run for 1 hour, 2 hours, 3 hours. So for this case of esophageal cancer, we give cisplatin. We can also give 5-FU. 5-FU is a drug which can run for 46 hours. But it really works. When you are given
Wait,
chemotherapy, it will shrink
like
the tumor.
46 hours continuously?
Continuous. So
Oh,
it's that. But
very, very
people
tricky.
appreciate.
Yes.
Yeah, so it can the chemotherapy will shrink the tumor, because you find the tumor is large and it has blocked the esophagus. So it will shrink the tumor, and you can still go back and swallow your food, and you can go back to your normal lifestyle. We also have radiotherapy. Radiotherapy is where they use I-beam radiation on that specific place where the cancer is. So on this case, we are doing radiation on the esophagus. And the beauty with that, they just put the beams where the tumor is. And this one, we call it fractions. You can get 30 fractions. And the beauty is that share pays for it. And you just look for accommodation, and then you get your radiotherapy. Radiotherapy takes about 10 minutes per day for 30 days. There are also some side effects from radiotherapy, but we usually manage, and it's manageable. And it's really, positivity is high. It's a good mode of treatment, and we encourage the public to come for treatment. And then apart from the surgery, the chemotherapy, and the radiotherapy, we also have palliative. Palliative is whole. We have to support this patient holistically. We have to give them pain medication. We have to bring the spiritual people on board. We have to bring the public and also the friends. We support this patient, and the patient will really feel all round.
Okay. Do we have treatment for different stages?
Yeah, we have different stage. Like now for stage one, we do the surgery. You remember I told you
Oh,
we remove where the tumor, and then we treat the patient.
so a stage 4 patient cannot
Stage
do
four
the
patients, we just
surgery?
do the palliation. Yeah, we give them pain medication, and we support them by maybe how they will feed. We also give them health education. We also assist them, maybe the family should assist them in doing the daily activities of life. You find someone is very weak, they are now depending on fluids only, like porridge, milk, juice, and other things. They can't eat the egg, so they are also weak. So sometimes I told you, most patients also will put the gastrostomy tube. Gastrostomy tube is whereby you put a tube in the stomach direct, and the patient will be fed direct on the
The
on the
tube.
stomach
Using the
using
tube, yeah?
the tube. the G2. So this one also needs the relatives to support the patient, and the patient will just get the balanced diet. They're also taught on now, like, what are they supposed to be given, and maybe the duration and the care of that pipe. But they should also come to the hospital for checkup and follow up for the same. Yeah.
Okay, what are the side effects patients usually experience during the treatment?
Yeah, that's a good question. We have several side effects depending on the treatment. So number one, for chemotherapy, you find that most of the patients, the air fall out, but we advise them, though after the treatment, after the chemotherapy, your air will just come back.
To just grow back normally.
Yeah, so we tell them they should shave. For ladies, we also advise them to have the wig and just accept it. It's just for some few weeks. So there are also there's also pain.
Wait, after how long of chemotherapy does someone's hair start falling off?
It depends on your genetic DNA. So my hair and your hair is different.
And
Your skin and my skin is different. But we always tell them maybe after the second, third dose, the cycle, the hair will fall depending on. But we always encourage them to shave to avoid disappointment.
yes, yes.
Yeah, for the men it's easy because they just do the Jordan way.
shave,
They
yeah.
look smart. So for the ladies, they we prepare them. They shave their hair, then they put on the wig, or even some just living without the wig. Yeah. So another side effect, which is a major one, is fatigue. Fatigue is getting tired every now and then. When you get this chemo, you get the radio, unachoka. You just find like you are tired, you are tired, you are tired. So we advise them to rest and do just things which is within their normal. Yenye wanaweza fanya. So fatigue is just, it cuts across the border. When you also go to radiotherapy, you'll find there's the skin changes. It could change because the beam radiations will go through the skin, but it's not a big deal after the radiotherapy, after the treatment, the skin color will
Goes
come
back
back
to
to its
normal.
normal. Yeah.
Okay. About
There's also
fatigue.
loss of appetite, which is there. So we encourage them to eat dry foods and eat the foods they like as long as it's balanced. There's also nausea and vomiting. Nausea and vomiting is also very common. We also advise them to just eat small, frequent food, and just to maintain the nutrients in the body and maintain the just maintain everything. Yeah.
So they're advised to eat small amounts multiple times.
Small frequent balanced diet, just
Yeah.
small frequent, a snack, fruits,
As
just
long as
like
it
that.
should be
Yeah,
balanced.
you should not just say I still have nausea and vomiting. It will not go very fast, but we'll also give you antiemetics which will boost you to have the appetite. And
Okay.
we still also tell them to take a lot of water is key and water is life, and it will really improve their cells. Yeah.
You've mentioned fatigue being one of the
major
what are you talking
major side effect
one of the
of treatment.
effects. Yeah.
Yeah, yeah.
I read somewhere that fatigue can also be a sign of cancer.
Yeah,
Not
yeah,
necessarily
it
the
is a
esophagus.
sign of cancer because, like, if you remember, I told you cancer is abnormal multiplication of your cells. So when your cells abnormally multiply, you will feel like you are tired. Yeah, because if they were around, like maybe the cells have multiplied and multiplied and multiplied. So one of the sign also of other cancers is that fatigue. Machoka sayote. Yeah, so just don't take it like for granted because you have not done every duty and you just have that fatigue. Just see a doctor.
Okay, how successful can a treatment? You've spoken about the surgery, the first stage.
Yeah.
So how can it be successful? Can we cut? What am I saying? How successful is the treatment if cancer is caught early?
I told you when it's stage one, it's very successful. Why? Because we do the operation on where the tumor is, we remove the tumor and we treat you. And a specialized doctor will do this, who is a surgeon. And positivity is 100%, and you'll just follow on checkups because you may not know. It's just good to be on that checkup. Yeah, stage one cancer is treatable, but you'll still be put on follow up
Okay.
with with oncologist. Yeah.
And does the esophagus treatment affect the speech?
Yes, somehow it affects the speech because it depends. Like stage 3, stage 4, it has to affect the speech. Yeah, because these organs are nearby.
Yeah.
Yeah.
I know it affects the swallowing because you've spoken about the putting of tubes on the stomach.
So when it comes to stage 4, it will affect because it's now rampant. It's all over. Yeah, even stage 3, you know, it
Is
is yeah,
blocked.
it has passed to the esophagus, so it has to affect because the focal box is just around. Yeah.
Okay. How do patients cope with physical and emotional challenges?
It's tricky because even you today, if I tell you now you have cancer, even if you don't have cancer, you'll just that shock.
Just panic.
So it's something which is we patients have stigma, clients have stigma, the family will have stigma, and also even us as Kenyans, you just name somebody, this one has cancer, this one has cancer, this one has cancer. So people should have integrity with patients with cancer. So that one you'll just go into shock, but we'll assist you to come back. Patients start when they are very low, their self-esteem will just go very, very low. But with time, as we talk to them and we start medication, they will catch up and they will move on with life. You find people who have had cancer for many, many years and they are still fighting it. Yeah, and we call them survivors and fighters, and they are doing very well in this country. And we have even support groups for cancer survivors. They talk to themselves through WhatsApp, they encourage themselves, they do businesses, and they live a normal life. Cancer is not a death sentence.
Yeah. You've spoken about survivors of cancer, and I know it's a bad thing to ask this, but do people have cancer? Let's say you've survived. Is it probably normal
Survivor,
for you to
let me
have?
give you the terminology of a survivor. Survivor is someone who had cancer and they are still getting treatment. Even if you were cured, you are still fighting cancer. As long as you had cancer one day, you are a survivor. If you are not on medication, if you are on medication, if you are free cancer, you are still a survivor.
Okay.
Yeah.
Can someone be fully put away from the cancer medicine after
Yeah,
cure?
yeah, very possible.
And is it probably normal for the cancer to come back?
Yeah, sometimes it can come
The
back.
same cancer?
Yeah, it can come back.
And what really causes it? Probably going back to the
Uh,
same lifestyle or
you see, like apart from esophageal cancer, you can see like breast cancer. There are chances of very high because of the metastasis. So some of these cancers are very sharp arrows. So you think it's done after some time, maybe you're in the right breast, it comes to the left
left
breast.
breast?
So we'll not tell people like 100% treatment, but it's just a blank answer. But stage 1 cancer is treatable. We advise them to be keep checking the appointment. They should not leave the appointment with their doctor. Yeah.
Okay. And how does the role of nutrition play in the recovery of cancer?
The role of education.
Nutrition, sorry,
Okay,
nutrition.
nutrition. Nutrition plays a big role, not only in cancer, but across other diseases. When you have low immunity, you'll get infections every now and then. Hygiene also should come in. People should take care of the hygiene all round. And for this cancer, you should take care of the oral hygiene. Yeah, I think people should also cope with good lifestyles. If you are clean, people should also avoid that maybe kissing and such lifestyle. It's just good to know like what about the lifestyle of this person. So we need to be clean. We also need to take care of ourselves. Yeah.
So basically, be clean and you'll be associated with someone who you're sure is also clean.
Yeah, and if so, I don't know. It's tricky. Yeah, people should just know how to live well, stay well, eat balanced diet, take 3 meals in a day, ensure we take fruits, ensure we also take vegetables in every meal. Vegetables really boosts our blood and it also boosts our immunity.
Yeah, okay.
So lifestyle plays a big role. Check, do exercises, and also make a visit to the doctor when you are not sick, which
For
is very
checkup.
important.
Okay.
Yeah.
What about rehabilitation? How does it play a role in recovery of the esophagus cancer?
Rehabilitation is something which is very, very key. We have something known as multidisciplinary. When someone has cancer, we practice multidisciplinary. Multidisciplinary is whereby you have an oncologist, you have a nutritionist, you have a nurse, you have a radiography, you have all those specialties. So when all these specialties manage you and you humble yourself and follow the medication or the protocols of the treatment, you're just good to go. Yeah.
Okay. Um, What are
So
the
rehabilitation in this case for cancer of the esophagus is whereby life will change, and mostly feeding style will change because you will not swallow as you used to swallow. So you need to talk to the client and also the family members to support this client. Now this client will switch to liquid food, that is uji, maybe porridge, milk, and other things which are. And then again, rehabilitation, having cancer is not a death sentence. You can still be put the tube and you can still be fed through the tube. If you are doing your job, like maybe if you are doing business, you are selling your supermarket, you will still do your business. You should not just keep off from your daily activities of life. Like today, you are diagnosed with cancer of the esophagus. You say, I will not work, I will not do anything, you will not go to church. Your lifestyle should continue as long as you have the energies. And also, you should sober up your mind and accept it. Accept it so that you avoid yourself from going into depression, denial, anger, and all such negative things in life.
yeah.
Yeah.
Okay, you've spoken about the support from the family and let's say the friends. But do we have other groups that, let's say the cancer group, but specifically for each and every cancer? Do we have that group that supports individuals?
Basically, we don't have. I don't know of anyone of any group now, but I know we have several cancer survivors groups in WhatsApp. But my prayer in future, we need to put one cohort like breast cancer. They should be there. A cervical cancer, it will be very very manageable. But what I usually do in my place of work, I put maybe like 6 or 5. We talk to them. We have just fun. Sometimes we just ask random questions. They feel good and they feel good. But if they come there, they keep quiet, they get the treatment, they go home. It's like they're just seeing a grave beside them. So they should also be given something known as yoga, maybe exercise to keep them busy. They should listen to music. They should also go to church, and they should also do what they love doing in their life. Sawa sawa. If someone was watching maybe football, they should continue watching football. It will boost their immunity. If they were listening music, if someone loves to listen music, let them continue listening music and give them more music and give them more time to listen to that music. Yeah. Life
Basically,
will should just move on.
life does not stop the moment
Yeah,
you're
life
being
does not stop
diagnosed.
with the diagnosis or confirmed cancer.
You just have to
Yeah,
continue
you
enjoying
just
your
have to
life.
continue with life.
So
And people continue doing their.
there are
They
no
should
one
also go to
activities.
social media and tell us, I have this, I have survived this is what I have gone, and also tell us the strength and
That is like
the
creating
weakness.
awareness
Yeah, they
to
should create awareness. We have several survivors in YouTube and everywhere, and even in the television, and we're happy for them. Yeah.
So what is the survival rate of the esophagus cancer?
Survival rate, it depends. It depends with how someone takes this cancer. It also depends on the family support and also economically. You cannot compare somebody who has a super cover and someone who is paying cash.
Yeah.
And I'll advise people that let us not pay treatment with cash money. That one is like, it will just be for some time. It's good to have a cover because the treatment is really expensive. And I think SHA is paying for most of our clients. So people should just have a cover, and people should also support them. If you find someone who is has depression, who is stigma, and there is no family support, this patient will not cover. But there are patients can live even over 5 years and even more than 5 years with cancer. So cancer will kill you depending on how you perceive it. It's just like when a girl has pregnancy, you'll go into depression. But another one will accept that I have a pregnancy, and they'll just carry the baby and have the baby, and
There's
you'll
nothing
not
you
change
can
that
do about
condition,
it. Yeah.
and you just live with it. So it depends on how someone will take it and the support system of
I think
that
it
person.
majorly depends on the support
Yeah,
system.
support system.
Because if someone stays alone, it will be bad.
Yeah, it will be bad, and even some can even go into more
Depression.
alcoholism, more smoking, more tobacco. But people should just be positive in life. Cancer is not a death sentence.
Okay.
Yeah.
So what are the myths and misconceptions of the esophagus cancer?
The main?
The myths and misconceptions of the esophagus
Oh,
cancer.
great. That's a good question. You find most people, let me say, I come from Rift Valley. You find the Tugens, the Elgeyo Marakwet, the Nandis. They think this is just a curse. And people will just go for herbs, go for witchcraft, doing all those things. You find them coming to hospital with a lot of cats and a lot of herbs because they think it's a curse. But people should just know this, and a disease like any other disease. Cancer is just like any other disease. We call it non-communicable diseases. So you can eat many things like any food. It's not. There are also other non-communicable diseases which are even more bad than cancer. So our people should know that cancer is like any other disease and it can be treatable. Yeah. So other myths, people believe it's witchcraft. Others believe it's just like demons. Others believe it's, I don't know. People have different perceptions. But majority, they believe, like now, the Kalenjins believe that cancer will not go alongside with kiss, with knife. If you just do the what do you go? If you just do the biopsy, the best diagnosis of cancer is something known as biopsy. Biopsy is getting the meat or a small piece of meat in that tumor. Then they go for histopathology lab.
Yeah.
Then they do in the lab, they will see if there is cancer cells. So our culture, most people refuse that biting small, we call it
Cutting of
biopsy.
small
So they
meats.
believe that cancer does not go with the knife.
Mm-hmm.
They think if you cut it, it will spread very fast. So people stay until when it's very late.
Yeah.
But all the same, they go to those hubs and they go to those places, but finally they'll come with a wheelchair. But today we tell people, just come to hospital, they'll check you, they'll give you medication, and you are good to go, and you are safe. Hubs will never treat cancer. Hubs will
It's so
never.
hard to like switch someone's mind
But nowadays,
about
people are positive.
people are
It's not like
positive.
the more we do the sensitization, people are positive, and the government is also doing a good job. Also, the National Cancer Institute is doing a lot of awareness in our community, and I think National Cancer Institute is doing a good job, plus other platforms. Yeah.
I think people are also more informed compared to the past. At least now people know if cutting the small meats what it's going to do, and like in the past someone will say no, you
They
cannot.
know, but culture is culture, and it's
Yeah, it's
it's
so
really
hard
hard.
to.
It's really hard to remove someone from culture. It's like telling me don't take milk, and I'm challenging. So we are still trying to tell people, let us come out of our myths and let's go to hospital and accept what the doctor is saying, because every doctor who is there is just there positively for you and positively for your life, and everyone wants you to live long. Yeah.
So, for instance, today you get a patient that thinks the traditional medicine, I'll say the herbs, is a better option. How are you going to advise them? It's so hard to switch someone's
It's not
mind.
that hard. We'll,
Huh.
we'll, 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 we'll really do a lot of education to that client and to the relative. And also we'll bring those who have finished the medication. I can bring someone who has undergone surgery, chemotherapy, radiotherapy, na amepona. So, in our culture, we say iron will sharpen iron, and also another human being will sharpen another human being. So, for that case, you can bring a cancer survivor for esophagus cancer, and you bring to this one who is fresh diagnosed, and they will journey together, and it will be a positive result, and they will celebrate one day. That's how we do.
And
Yeah.
that way now they will see
And we
that
also
they.
do follow-ups with them. We also give the advantages, and we continue giving them positive vibes about treatment.
Okay, okay. So, what advice would you give someone who is worried that they have the symptoms?
People should not worry. It's just good to know what am I suffering from. Let us go to the hospital. Let us do tests. We have several tests in this country. It's just good to test yourself. Girls, I like girls. When they miss periods, they go for pregnancy test kit. Even they buy it over
Immediately.
counter, they know pregnancy test kit. It was both. It was negative. So the same with these cancers. Let us go
For
for
checkups.
checkup, because this one is bad. For a baby, you'll go to maternity, you get a baby. But now for cancer, you are
There's no
waiting
going
stage 1
back.
to go to stage 2, stage 3, till stage 4B, which is untreatable. So we are telling the public today, cancer is real, but cancer is treatable if it's early diagnosed. More the same, people should stay healthy, people should eat healthy, people should check on their weights, and also avoid the alcohol and smoking. Yeah, it does not have any positive impact on our lives.
Yes.
Alcohol, tobacco, lifestyle, let us just do what is expected of us. And everyone should take care of themselves and tell a friend to tell a friend.
Okay, thank
Yeah,
you so
yeah,
much. Thank you
yeah.
so much. Now we've come to the end of our podcast. I don't know if you have any advice for our viewers according to let's not specify esophagus cancer. Let's just say any advice according to any cancer.
Thank you so much for having me today. I'm really humbled. I don't take it for granted.
Thank you.
I am humbled that you chose me. I'll be there to create awareness any other time if I'm called. So for the public, cancer is not a death sentence. Let us just follow what we are supposed to do. Let us check on our diet. Let us check on our exercise. Let us check on our lifestyle. Let us also preach the gospel in the churches, in the youth, in everywhere, that cancer is not a death sentence, but let us try to prevent. Prevention is better than cure, and even the government is now working under primary health care. We are trying to prevent. Generally for cancers like cervical cancer, for those people who have girls who in primary schools, let them get the vaccination of the HPV. Again, I'm telling my viewers, next month is Breast Cancer Survivors Month. We will be celebrating breast cancer survivors, breast cancer in the month of October. We call it a pink month. So we will be there, and I'll be glad to come back here and talk about breast cancer, because this is a deadly disease, and it's among the top cancers in this country and globally. Yeah, it's not a joke, but yeah, I'm not scaring anyone, but let us stay safe and let us live healthy. Thank you so much.
Thank you. Actually, you're putting awareness. You're not scaring a lot of people, because these young girls need to know about the breast cancer and any cancer.
Yeah,
that
so
is
next month is a
there.
pink month. It's breast cancer month. So let us be there and join hands and also support the survivors. We do let us love them. Let us support them. Let us keep them company. Even if you meet a survivor, just hug them. They feel so good. Yeah.
Thank you.
Thank you so
Thank
much.
you so much.
Thank you.